And welcome back. The African International Collaborative Center, AICC, is a not-for-profit organization passionately committed to preserving and celebrating African culture, fostering unity, and empowering African women and youth. Now, they serve as a resource hub for immigrants, actively promoting collaboration with various organizations, fortifying African immigrant families as well as communities. And here now, we've got two very special guests, AIC's Deputy Director, Angela Paulino, and Executive Director, Dr. Hadiza Osuji. And thank you both for joining us.
Thank you so much for having us. Thank you.
Glad to
It's
have you. Glad to have you. So, as we talk about the center, obviously, building community is at the forefront. How can we go about? I'll start off with you first, Dr. Osuji. How can we do a better job as a nation in terms of supporting our African immigrant communities?
well, first of all, I would like to say it's by truly understanding the issues of the community, the needs of the community, and also their cultural context, right? And it will also, and it's for us to be able to achieve that will include leveraging, community-based organizations that focus, on the African community and working, at the grassroots level in different ways to meet their needs. So with the collaborative efforts and really understanding the needs of that community, that will play an important role in, elevating their issues.
Yeah. And Angela, a little bit more about the organization. I mean, I gave a little lead to our viewers as to what you guys are all about, but share with us a little bit more in depth and take us behind closed doors.
Yeah, so AICC, that is the African International Collaborative Center, is a nonprofit organization embedded in the community, specifically the Bronx. And essentially, it is established for the charitable purposes of promoting our African heritage and ethnic pride, promoting our ethnic values. Uh, Promoting community health education, conducting civic engagement in the community, and also to serve as a hub of resource in the community. That way, Africans, in the community will be able to have access to existing resources that are available to them. And also at AICC, we work to empower African immigrant women and youth for success. And we play a big role also because we believe collaboration is key. And so we collaborate with other organizations, policy makers, institutions, faith-based organizations to build and implement, to develop and implement programs that are relevant, that matter for the African community.
When we talk about the need, I want to say we thought we had Angela, we lost her for a second. So if she comes back before the end of the segment, we'll bring her in. But Dr. Osuji, talk to me about the needs in the African community, the immigrant African community, right now as we look and assess what's going on in our neighborhoods. What would you identify as some of the more prevalent needs?
Well, as you know, the African community is disproportionately affected in every way you want to look at it, be it health, mental health. Even look at during the COVID-19, the community that is most disproportionately affected is the African community. And and sorry, could you repeat the question again? I think I lost.
Yeah, we're talking a little bit about what's the most prevalent needs that you find right now for the African immigrant community.
Oh, access to resources, information, and yeah, and also culturally relevant, be it health, culturally responsive programs and services are lacking, and that we need, that we need to address
Yeah.
really.
I got Angela back in. I thank you. And, you know, that's how technology works. Sometimes we're in, sometimes we're not. But I fell out of a couple of rooms myself. So it's okay. Glad to have you back. For your organization, obviously, the goal is really to have some advocacy and at the same time have a place, a haven where people can come find more information. For yourself, talk to me about the organization and the work and the impact that you feel that you're making right there within the community.
Um, well, we are creating a space where the community can receive education about different aspects, especially health and mental health, which are areas that, especially mental health, that sometimes it is difficult for communities to access because of stigma and other issues. So we are creating a space where community can be educated, can connect to services, can have leadership development activities where we can help the community engage in government participation, right? Like civic engagement opportunities. So we're creating that safe haven where community members can, um, one, connect to services, two, receive education, leadership development, um, and also where the African culture can be showcased.
Yeah. When we talk about the African culture, I want to talk about two words: food insecurity. Huge around the United States. Talking to some to say, when it comes to African immigrants, there is a tremendous amount of food insecurity, particularly for people in New York City. What have you found?
Well,
That
we
is that.
conducted, go ahead, go ahead.
No, go ahead. Go ahead, Angela. Go ahead.
No,
So
you
we,
go. No, you go. No, you go.
during the heavy time of the pandemic, we conducted a food pantry program where we, um, provided basic items to community members. Um, and also we work kind of like directing people to connect with services. So if people need information, we can connect them with um, places in the community that offer services. Because unfortunately, and this is something we keep seeing time and time again when we run programs in the community, is that sometimes there are services available, but community members are not aware that those services are present in their community. So one big aspect of what we do is providing information about where the services are and how people can access them.
And yeah, and if I may interject too, real quickly. So you're absolutely right. And one of the issue we're facing really is that sometimes, even though the food is available, right, the food they are not culturally they're not culturally, how will I say, responsive. Right? So, especially in our community, as we serve the African community, including the immigrants at large, and when they go to, if at least, even if they get access to this food, sometimes it doesn't go well with their system and may even result to health issues. And that is what we are also finding with the new migrants, asylum seekers that are coming in. They sometimes when they do get access to food, but the food is not congruent with their cultural context. And so, and in some way, it even create health issues, for them. And I am happy to interject that when during the time and when we were doing our food pantry distribution, we were lucky in that when we solicited for grant funding, we were able to get a grant award from the New York Immigration Coalition. So we were able to now provide food that are culturally, responsive to the African community. And that went a long way. And of course, I keep getting bombarded with calls because it is not just found anywhere. Because we had to tailor the sort of food we get and that we distribute. We had to tailor it to make sure it is culturally, I mean, we take into consideration the cultural context of our African community.
Yeah, when we talk about cultural competency, that's huge. We know that sometimes people fail in this area of being culturally competent, particularly when it comes to the needs or just the history of the African immigrant community. What are some of the ways that you're going about sharing that in terms of cultural competency? I know that workshops and seminars and things like that, but take us through some of the work that you're doing to try to make people more culturally competent of what's going on within the community.
Yeah. So one of the ways is really even uh, at the onset of the establishment of AICC, since we know we were going to be focusing on the African community, the first thing we thought of was I mean, the need to establish an African community advisory board because then the African Community Advisory Board will serve to guide and ensure that our programmatic efforts are, culturally and contextually relevant. And so we have an established community advisory board consisting of key stakeholders, key African stakeholders in the community. We meet monthly for 2 hours to really address the issues of concern in our community and to sort of to make sure and tailor our programmatic efforts so that we our programs are effective and they actually meet the cultural context of the community we serve. And in addition to that, in terms of promoting culture and and ensuring, we're touching the needs of the African community, is we have like, particularly focusing on the youth, we have a program called Tales by Zoom Live. This is essentially a story time where we try to promote our African heritage and ethnic pride, connecting our youth to our African roots. Because back in the day, in most African countries, usually our parents, our aunts, and our uncles, they gather us under the moonlight and they tell us stories that will promote our ethnic values, that will promote moral values, that would uplift us, and we learn a lot from that. So we thought that to promote our African culture, to preserve our culture, it was important for us to implement this program. So it is for youth ages 6 to 13. It is held. It is called now Tales by Zoom Light, of course, because
Right.
we're in the modern world, and the story is being held is conducted via Zoom every Saturday at 4 p.m. And
Angela,
also,
before I want
Um,
to, I don't mean to cut you off. I want to ask Angela about a question because as you talk about the work that you're doing, uh, the impact. Obviously, there's so many people who have benefited from the work of AICC. How would you define the impact of the organization within the community?
well, I would say one of the main impacts is the bringing information to the community, bringing education to the community. One of the programs that we conducted was a stress management and support group for healthcare workers in New York. And that was extremely helpful because healthcare workers um, were the face, right, that patients would see in the hospitals for support when sometimes even their families were not allowed to visit them in the hospital. But these workers were extremely stressed because of all of the things that they were seeing and having to deal with. So we conducted a few series of a support group, and we're still connected with these healthcare workers through a WhatsApp group where we support each other, place messages, etc. But there's also the other parts where we um, make the African culture a big presence in the community by showcasing it through the African Wisdom magazine, which is a magazine that we publish quarterly, and it basically showcases um, events that promote African culture, the attire, the food, the culture, families, organizations that cater to the African community. So, in besides that, there's also the civic engagement part that AICC is creating in the community, participating with the New York City participatory budgeting program. That's just one example where we engage different community stakeholders to create a coalition that would inform the community and create programs so that community members can vote and decide what programs they wanted to see in their community. And then later, we engaged community members to actually vote for the programs they wanted to see. So the civic engagement is a big part of what AICC is doing, along with the advocacy part, where we have joined, as Dr. Osuji mentioned earlier, the New York Coalition for Immigration. We have joined other organizations to also advocate for the rights of immigrants. Um, so in this way, we are creating impact in the educational side, in the mental health side, and also in the civic engagement, while also promoting and showcasing the African culture.
Well, ladies, I want to thank you so much for joining us. I mean, certainly a lot to discuss here. And Dr. Hadiza, before I leave, please give people contact information if they want to reach out to the organization, how to go about doing it.
Yes, so they can contact Hadiza Osuji via email. Hosuji, that's HOSUJI at africanicc.com. And also they can visit our website, www.africanicc.com. They can also find us on Facebook at africanicc.com.
Wow.
Thank you. Yeah.
Thank you so much, Dr. Osuji. And also, we want to thank so much Angela for being with us as well. Glad to have
Thank
you
you.
both here.